Hi, I'm Dr. Shrinivas Narayan. I am Director Urology and Renal Transplantation, working in Fortis Hospital and Kidney Institute for last 15 years. Our experience so far has been wonderful because this has made our surgeries quite easy. We can take up difficult cases, and since the cost factor is very low, it is not adding up to the cost to the patient, and we are able to achieve the same surgical outcomes better than our laparoscopic surgery with this new robot. Since it's an extension of laparoscopic, those who are graduating from laparoscopic surgery to robotic surgery, it is having the same open console system whereby you will be feeling like as if you are doing an laparoscopic surgery in a robotic form, where you have a better control, better manipulation, as well as you can do difficult cases with ease. Robotic ureteric reimplantation in a 25-year-old girl who came from Bangladesh, and she wanted that I should be out of this hospital in quickest possible time, and plus since she was a young unmarried girl, she wanted there should not be any scar. That was a very complex surgery because she was having a congenital malformation whereby lower ureter was entirely stenosed right from the birth, and we have to do a ureteric reimplantation, and we were able to achieve the outcomes with minimal incision, and she was there in hospital for only 2 days, and thereafter she was discharged. That gave us a great sense of satisfaction operating on that patient. The precision and control are hallmark of any robotic system, and same is with the SSI Mantra. We are able to do the surgery in a very precise manner, very controlled manner, and as it is a robotic system, it allows us to do a complex surgery which would have been very difficult with a formal laparoscopic surgery. There are many colleagues of mine who are working with this very system. There is one colleague which I can remember, he is my batchmate. There is Ritesh Monga from Faridabad. He is my batchmate only. We studied together in BHU as well as in Kolkata. He is doing good amount of cases at Faridabad. And lastly, I heard, he has shown also, he did a robotic renal transplant. Probably he was the second person to do a robotic renal transplant with SSI Mantra system. So it speaks volumes about the system. A robotic renal transplant is supposed to be the highest grade operation that can be done with a robotic system. Cost is very minimal and it doesn't add to the patient. The instrument per se, the consumable cost is quite less. We can achieve the same set of patient outcome with SSI Mantra system because not only it has brought down the cost, because of this cost factor, this system is able to penetrate into the tier 2 and tier 3 cities. Even this system is very tuned up for telesurgery, which has been going rampantly. So we can reach up to the places where there is no formal urology centers are there. So since it is an Indian system, they modify according to our need, and people can get robotic surgery advantage with minimal cost at their own places.